start with one. Thanks. We were told if we have to. From Yale. I'd like to call the August Advisory Board of Health meeting to order. If you could please rise for the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. If we could have roll call, please.
Let the minutes reflect those that are present. But before moving on, I would like to make a motion to amend the agenda.
Okay.
I would like to motion to move the citizens' comment and the correspondence to follow item 10. In the interest of time, I know I have to get back to work, care for my patients, and I know that one of the other board members
Steve,
typically
yeah,
leaves
Steve.
early.
He'll be here in a minute.
So we heard many hours of public comment. We have received numerous emails.
Folks,
So we need to get to our business so that we can have our votes counted before we have to return to work.
Point of order, was there a
Madam-
second? I'm sorry. I
Second.
didn't hear it.
Well,
Okay, thank you. I just
Madam
didn't hear
Chair,
it. Thank you.
based on Robert rules, do we need a motion to amend the agenda?
we do,
That's what she just did,
yeah.
and I second.
Discussion?
Yeah, it's discussion.
My discussion is that if we doing that, that means we're all public comment. If we make motions before public comment, then any public comment is nothing deemed on our decisions. So they might as well not even speak other than just to voice themselves. I understand the concern, but this, and it's tough, but when you volunteer for a board or you have a job or whatever, you understand, you know, what comes with that. And of course, we, as long as we have a quorum, if people have to leave, they have to leave. We make that personal decision, understand that. I have lots of qualifications. I work for the college. I'm on college time right now, but they understand that I need to be here. And I respect that with others, but we cannot, that's like silencing the public. And that will not go over well with this health board, and it definitely won't go over well if our commissioners support that. Even though we know Mr. Felix doesn't have a vote here, but they would come back to them. They would, regardless of what we do here, the commissioners still, they're held accountable, even what we do, because they appoint us. So I think, I understand, I respect that and why people may need to leave, but they knew what they were signing up for when they decided to serve the public and to be a part of this advisory board. So I will hope we would not do that. We would not move the public, we would not silence the public.
Further discussion?
Yes. We're not silencing the public, we're just simply moving that public comment. We sat here for 5.5 hours and listened to public comment on Thursday. We were inundated with emails after emails after emails throughout the weekend that we spent numerous hours reading. We're not silencing the public. We gave the public ample time to speak. Because of that time that we've invested, I do want my vote. We have to take official, we were going to vote on Thursday, but we decided to wait so we can all think about it. So I'm just simply doing this to request the official business be moved up. The public can still speak, we can still discuss the correspondence, but per Robert's Rules of Order, this is, you know, what we're able to do, so that's what I'm proposing, so that we can get our votes in.
Thank you, Madam Chair. I recognize the great sacrifice people on this board and other boards make with their time. It's considerable. 5 hours the other night, as was pointed out. As a commissioner in this county and an elected official, I cannot support anything that even becomes close to restricting the speech of the audience. I agree it's a great sacrifice, and feel like I should apologize to those that are going to be missing work and things. I did that many times in my career for other things, and it's tough. But to take away the voice of the citizens that we are sworn to represent is something I can't abide by personally, even though I don't have a vote on this board.
Any other discussion?
I would like to amend that motion. I move to amend that motion, if that's worded correctly.
Request to.
I request to amend the motion. No, I haven't made the motion yet. I will get there. I was just trying to word it correctly.
Okay.
I would like to amend the motion to maintain the agenda as is, but fix the adjournment time to 11 a.m.
What was that?
to fix the adjournment time to 11 a.m.
So if we're just done with public comment, we're done. Is that your motion?
So that it is fixed. That is within Robert's rules.
Well, I
do.
think, what
To
you're
fix the
stating,
time.
you want to suspend the meeting then? That would be suspending the meeting.
No, that is fixing the adjournment time. That's not
That
not
means we would
suspended.
not get through all our agenda.
You don't know?
It's gonna be
We need a
done.
discussion before we.
We need a
we
second
need
on
a
the
second.
motion
I'm
to
sorry,
amend.
Kevin. We need a second before we discuss. I apologize.
Thank you for that, thank you.
I will second that, since it's as per Robert's rules. I understand that Carolyn and Leanne and Steve have patients that they have been rescheduling here for these meetings for several months. With the solar, we went on for hours. Used to be our meetings were only 45 minutes to an hour. Now these meetings are going 2, 3, 4, 5 hours. So I get where they're coming from, and it's per Robert's rules, so I second that. I second that motion.
Because we're in discussion now. Madam
Yep.
Chair, again, this is something that's happening across the country, across the state and in this county. People, and this is not the first time, when we had the issue with the health officer, those meetings were moved to the convention center. So many people were concerned and involved, and it went on for hours. That is the way it is. And so they saw the trend when they decided to serve on this board. They've seen the trend of the county. People concerned, that's a good thing. We have people battling it out for board seats where they're getting nothing, basically no money. They want to serve. And when you make that decision, you understand, I'm sorry that you have patience to see. I'm busy too. I'm busy as a bee. I'm on college time right now, and they can prove me to be here. It is, I understand that also. Please do not silence the public. That's personal, that you have patience or you have your job. That's personal. Then that person may need to resign from the board if they cannot fulfill the requirements to be here. We cannot go based on people's personal issues. It's like bringing your personal issues to work. We have a job here. We're serving this public, and a lot of other people were at other meetings. There are other people here now. We can't go by what happened last week or the week before. We're going by who's here now who wants to speak. We cannot silence the public. Thank you, Mr. Felix, for your input on that. You're exactly right. We cannot silence the public.
Thank you. Anyone else? Okay, then we're going to vote on the amendment only, to amend to a fixed time of 11 a.m. All in favor?
Roll call vote, please, Madam Chair.
We don't have to.
I can request a roll call
You
vote.
can.
Thank you.
All right, where's Nicole? So we're going to do a roll call, well, we'll let you, Carolyn, you can do it.
Roll call vote.
Yep.
Leanne?
Yep.
Aye.
Aye.
No.
No.
Aye.
Okay, 4-3. That motion passes to fix the time to 11 a.m. Now on to the original motion with the amendment to move, so the public comment would stay where it is, and the time would be fixed at 11 a.m. We'll do a roll call vote on that as well.
Leanne?
Aye.
Aye.
No.
No.
Aye.
Aye.
Okay. That passes 4-3. So public comment will be in the order that it was originally intended to be in, but we will stop at a fixed time. This meeting will stop at 11 a.m. Okay. It takes us to citizens wishing to address the board. One person has to leave early. Angie Dufresne. As a reminder, as she's coming up, folks, I know that there's a lot of emotion on both sides of the issues here, so please respectfully keep your comments to yourself. Allow the speakers to speak. Everyone has 3 minutes. With that,
Hi, Angie Dufresne, Fort Gratiot. I would like to thank all of you. I mean, that 5-hour meeting was like crazy. You guys have put a lot of time into these meetings over the last probably 6 to 8 months. A lot of these people weren't at all those meetings, but you guys have been working really hard, and I really appreciate what you're all putting into our community. I was very disappointed with how that last meeting went. I will just mention that you never have that many employees from one place show up unless their leader encouraged it. I disagree with a lot of what they're saying. They're laughing at me now. So to have people in the crowd laughing at somebody, there was a veteran at that last meeting. He mispronounced, a gland in the body, and everybody was laughing at him. They laughed so much that this veteran, who was shaking as he spoke in front of that large crowd, left immediately after speaking. I think that this type of behavior is disgusting, especially when a majority of these people are in the healthcare field. So I think you all should really pay attention to your behavior and understand this is a business meeting. It is not the place to be laughing at people and making snide comments when other people are speaking. I full-heartedly support Dr. Nevin and all of his directives that have come out, including this directive. Public health is not free community health care. The health department has expanded what they've done since the pandemic, and we need to get control of it before we lose funding, because the grants and stuff that they are receiving, these are not grants that are going to go on forever in time. So I agree with looking at the services and making changes so that our county is ready for those cuts. And that's basically all I wanted to say today. Thank you so much for everything this board is doing for your community. Thank you.
Steve Gerza?
Hello, forgive my reading, I'm going to be precise. Hello, my name is Stephen Gura, and I am a professor of nursing at SE4, as well as the department chair for the Health and Human Services Department at SE4. I was also a former health advisory board member until this past January. I attended Thursday's meeting to get a better understanding of Dr. Nevin's memorandum. At the completion of the long meeting, I had a few thoughts that I thought were necessary to share with this group. First, Dr. Nevin is correct. Dr. Nevin is a well-qualified, well-credentialed, and very well-educated physician in his field and scope of practice. However, you would not have him remove your gallbladder, nor deliver a baby, or diagnose your toddler if they were vomiting bright fluorescent yellow emesis. That's because you have specialists in those fields. It cannot be expected for someone to operate outside their scope of practice. The scope of practice also applies to nurses. While in Michigan, we do not have a Nurse Practice Act, we do have a scope of practice as defined under the Public Health Code, general rules of the Board of Nursing. In short, all licensed nurses, regardless of their education, must have physician oversight. This includes nurse practitioners. Oversight does not mean direct line of sight supervision. Second, nurse practitioners also have specialties. So if you have a family practice nurse practitioner, they are educated to take care of families throughout their lifespan. They are great primary caregivers. However, their supervising physician should also have knowledge in that area. Dr. Nevin has said that he is not a primary care physician. Therefore, it is not ideal for him to have primary care nurse practitioners oversight. Again, in a real world, you would not have a heart surgeon supervising a pediatric nurse practitioner. I'm spelling this out because at the last meeting, it was suggested to double Dr. Nevin's hours. That will not solve the current community need for primary care. All it will do is give us more of the same. And while Dr. Nevin is extremely competent in what he knows and has done great things for this community, he is not capable, by his own words and actions, of supplying primary care needs to this community that this community has requested. Therefore, logically, we should have a second part-time primary care physician who has credentials for nurse oversight to meet the needs of the community. It is my recommendation that our Health Advisory Board vote in favor of this memorandum because it is technically and legally accurate. However, there should be an addendum or an opinion of dissent by the Health Advisory Board stating that closures should be temporary until another physician can be found, and present this as a potential solution to the board members, Board of Commissioners to meet the public's need. Thank you.
Thank you. Eileen Tesh?
Good morning. I just want to say thank you for moving this meeting up to this room. The taxpayers of St. Clair County deserve the best and want the best services from county officials, from elected officials, employees, and that includes this advisory board. I believe we're moving in the right direction, especially with the contributions, the expertise of Dr. Nevin. I knew nothing about the advisory board, didn't know anything about the health department until COVID. Thank God for COVID. So we woke up and we started taking back what belongs to the people and not to the bureaucrats. What transpired last week, I don't want to go through it all. I think Angie covered it. What I saw from the public comments and heard was an attitude of entitlement and superiority from these nurses, staff, former employees of the health department, not even looking at their expertise. As an attorney, I look at liability. And it was, all I could hear was, we know best, we will do what we want, and that's what we had under Dr. Mercantile. So I just wanted to say that this also includes the fact that we deserve the best, as I said, from this board. I did some deep dive and into some of the backgrounds of the board members, and the first thing that was revealed to me was regarding Mr. Watkins. So, Mr. Watkins, I don't blame this board. The commissioners appointed you, the former board of commissioners appointed you in 2023, but you've been publicly disciplined. And you stipulated to that discipline. Granted, it was in 2005, but the bullying from you and the bias towards Dr. Nevin is blatant. So just ask everybody to do better, and I will be at the Board of Commissioners meeting tomorrow. Thank you.
Thank you. Ruth Habeluski? Yep. Reverend Kathy Tessian, you're on deck. You're next up.
Good morning, everyone.
Good morning.
And thank you for the advisory board for the opportunity to speak today. I have been a resident of Port Huron City for 31 years. I worked for the St. Clair County Health Department as my last job. I was an environmental field coordinator, which is a fancy title for supervising health inspectors and being a health inspector. I oppose these memorandums on the cuts to the health department and on fluoride. I have two questions. What is the agenda for these changes? Is it to reduce the health department budget expenses? Is it a power grab for Dr. Nevins and his followers? The health department provides services to the public throughout the entire county. By limiting health department locations events, many county residents will be unable to access health department services due to lack of transportation, distance, time, finances, etc. These county residents pay taxes for these services. Then on the, this is going to be a real short email. EGLE is the authority for regulating municipal water supplies, not the county health department. I do not understand why the county is trying to overstep the state of Michigan's jurisdiction. As a child, I didn't have fluoride in my water. I have had many cavities, crowns, root canals. My children had fluoride. They didn't have those problems. Please consider that eliminated public health services outreach will not come back, and employee jobs will be lost. Does the county want to go backwards on health services and prevention? What are the future repercussions of your vote? Again, thank you for your time and the opportunity.
Thank you. Reverend Kathy Tessian. And then next up will be Amber Koningstor.
Good morning. I'm Reverend Kathy Tesson, and I have just moved to this community a year ago, just hit my year anniversary. And as I looked at the community that I would be moving into, I looked at how it cared for all of the citizens. And I live in Fort Gratiot, but I work in Old Town, Port Huron. And so in my day-to-day interactions, I often encounter the working poor of this community. And to serve the community, obviously you need to know the community. As I've learned what Port Huron and St. Clair County is evolving to, it's a little disconcerting because our economy is being built on the backs of the working poor. We want to tout that we're a tourist location, a tourist destination, but that means individuals raising families on changing sheets in hotel rooms, tips and serving drinks to individuals visiting for a weekend, mowing lawns for people that temporarily live in our community. We have a lot of individuals who are the working poor, and I see them weekly in the neighborhood where we reside. And so my deep concern is that public health is that gap for individuals that are trying to make it, trying to lift themselves out of poverty, but they don't have access to preventative services. And so I would beseech you to think very carefully about, to say, well, we could be losing grants down the road, but we have them now. So why are we not filling that gap and ensuring that our workforce is available to do these jobs that don't give them access to preventative health care within the wages they're receiving, within the benefit packages that they're offered? This is the community that we live in. We should be caring for everyone, and I don't see this memorandum as representing a care for the basic backbone of what this community has evolved into economically. Thank you for the time.
Thank you. After Amber will be Kathy Swantek.
My name's Amber Conagizer, and I do work for the health department, but I was not told to speak, and I've never worked under Dr. Mercantile, just to put that out there before my speech. Good morning, and thank you for giving us the chance to continue this important conversation. At the last meeting, there were comments made about a supposed lack of communication within the health department. I want to respectfully clarify that that is not the case. Our programs hold regular staff meetings, administration meets as well, and the information from those meetings is passed down to each program so that the staff are kept fully informed. Communication is something we value and practice consistently. The word respect was also raised with concerns that staff may not respect our medical director. I want to be clear, we do show respect, and we certainly respect his credentials. But respect is a two-way street. Since his arrival, many of us have heard comments about programs being cut, staff being unnecessary, or people needing to find other jobs. That atmosphere makes it very difficult to feel respected in return. Another concern is how our medical director views the role of our nursing staff. He has stated that nurses cannot operate under standing orders unless he is physically in the building, yet he only works 16 hours a week. This leaves a gap in services. Because our registered nurses and nurse practitioners hold their own license, credentials, and education, they are accountable for their work, and they should be trusted and supported to provide care within their scope of practice. If leadership does not take the time to collaborate with them, then how can there be trust in the system? Equally important is leadership and responsibility. When offered full-time, our medical director said he was not interested unless it gave him more power. If he does not have the time or willingness to support the programs, like school-placed clinics, then then the solution is not to close them. The solution is to find leadership that will. If that means considering an additional physician or someone else willing to carry the responsibility, then that should be on the table. Public health is too important to be scaled back because one person does not want the responsibility. Outreach, school-based care, and rural clinics are not extras. They are essential. Families, children, and vulnerable residents depend on them. On behalf of myself and my colleagues, I urge you again to protect these services and to ensure we have leadership committed to supporting the full mission of public health. Can I count on you to advocate for us? Thank you for your time and for standing with the people of St. Clair County.
Good morning. I'm Kathy Swantek. I've lived in St. Clair County for over 31 years, and I live in St. Clair Township. I do not agree with the proposals. I stated this at last Thursday's meeting. I'm asking that the Health Department continue outreach services to all individuals in our county. The Health Department has been taking these services to these constituents for years, and I disagree with the closure of any clinics that currently provide services in our county. They are very, very important. On the issue of fluoride, fluoride in correct amounts is beneficial to individuals in our community and strengthens the enamel, especially in our kids. And I certainly don't want to be taking my kid to the dentist any more than I have to. Approving these proposals is detrimental to our community as a whole. Prevention is always better than fixing problems after they occur. And if both of these pass, I can guarantee that that's what's going to happen in the future, and I wouldn't be surprised. Hopefully it doesn't pass, but if it does, that we'll go back. After a few years, we'll find out that this does not work for our St. Clair County people. Thank you.
Thank you. Kim Scheibel. After Kim is Connie Neese.
I am here again today to speak against this proposal. I believe that the Medicaid percentage of individuals in our county is extremely high, and that it will only go higher with the cuts that are coming from D.C. We have services that have been here for decades. I remember as a child living in Yale, going to the old high school, getting my immunization. That was through the health department, and we're talking a long time ago. So, I mean, it's been happening for years and years. And it was given by a nurse. It wasn't given by a doctor. There are many, many people that either have no insurance or now it has changed. When my kids were little, we did not have well care in our policy. So I took my kids to the health department for all of their shots because I didn't have to pay any extra money out of pocket. So I think that there are many people now that don't have any insurance, let alone dental insurance for fluoride treatments. So I stand here asking you to listen to the people. There were many people the other night. I don't have the percentage. I would assume that someone on your board kept a count of how many people that spoke against the policy and how many spoke for. And I would ask you to look at that and listen to what the people are saying. I am not an employee of the health department. I have never been an employee of the health department, and I have great respect for the nurses and doctors that do the daily work. But I just feel very strongly as a citizen of this county that you need to do the correct thing, and that is to deny this cancellation of services. Thank you.
Thank you.
Hi, I'm Connie Neese from Fort Gratiot. My name is Connie Neese from Fort Gratiot. Better? Thank you.
You can pull that down towards you also. There you go.
I have a height issue.
Yeah.
So I don't have a medical background, but I have used the health department services throughout my life. And I think that it's important to continue having outreach to the more distant areas. When my children were young, my first group of children, I was a single mom working, and I lived in Algonac. And the health department was the way that I was able to get my children immunized. Growing up, I lived in the areas of Algonac that had fluoride. We had city water. But some of my friends lived on well water, and you could tell the difference in that they've had dental issues their whole lives, and I really have not, because I had the advantage of having fluoride in the water that I grew up with. And I hope that you will maintain those things for the children in our communities. Thank you.
Thank you. Wilhelm? And then after that is Sharon, is it Curtis? Kertas?
Hi, my name is Luke Wilhelm, and I am also from Fort Gratiot. And I would like to simply say that I think that removing the public services is rather foolish, simply because it's going to put us in a position where we have less people have access to vaccines and healthcare, which are incredibly important to keeping our entire community safe. If people have less access to healthcare, then they are more unable to deal with having their own, sorry, I got my own head confused. Let me back up. Vaccinations, they are incredibly important. They've always been important to our own communities. If we don't have vaccinations readily available, then people aren't going to get them. And if they aren't going to get them, then people are going to be more susceptible to diseases, deadly diseases. Things like measles have already resurged in American Samoa just because of the policies that have been brought forth. And they have caused deaths, so many deaths already. This isn't even removing the ability to get vaccines, it's just restricting their access, and it has caused people to die, a lot of people to die. And disease has followed us forever, and I feel like people have forgotten how far people are willing to go just for even the promise of safety, not even safety itself. Before the smallpox vaccination, there was a practice known as variolation, where they would go sometimes hundreds of miles to places that had a recent smallpox epidemic, where they would take these samples from people who had smallpox and survived. They would ground them up and they would set them in the sun so that they would dry out, and then they would use that to scratch people who weren't infected. They would do this to their children, and it killed people, but it was better than the alternative. They were willing to do this just for safety. And we have a much better method now. And I just don't understand why we would make it so that it's less available, so that we would have less ability to keep ourselves safe. Safety is something that we have the access to have. We can have vaccinations. We don't have to have these horrible practices. We don't have to have the memory return of why we had these in the past, of why people died, of why there are so many small headstones in large old cemeteries, of why so many children died. We don't need the reminder. We've been through this. We know what happened. We don't have to go through it again. We just have to keep the services we have. I know it's doom and gloom, but public health is really important. Thank you.
Thank you. After Sharon will be Vicki Blackburn.
He met the qualifications as a preventative health physician to act as the medical director. He has been the medical director for 2 years, and he has had ample time to meet with the nurse practitioners, review collaborative agreement, and go to clinics and see the excellent quality of care that they are providing to the citizens of St. Clair County. He knows what the nurse practitioners can do and should be aware of their scope of practice. Dr. Nevin cites safety and inability to provide oversight with his part-time status as issues for consolidating healthcare clinics and not allowing a trained public health to provide immunizations and testing at community events. However, Dr. Morse is the medical director for 3 district health departments that covers 19 counties. And as a medical director and the only physician, she uses her 35 hours for the 19 counties to provide oversight to 12 nurse practitioners that work under her supervision, delegation, and collaboration. She provides services in communicable disease testing, family planning, women's health, children, adolescents, school-based care is also provided. She writes policies and procedures, including standing orders for immunization, testing, and all clinical activates that cover the 19 counties. I urge the citizens of the county and the Board of Health to access local health department websites to speak with the Michigan Department of Health and Human Services about medical standards of care. There are also public health booklets that are available online. Dr. Nevin has extensive education, and he is an expert at providing one-sided evidence that supports his beliefs and views instead of presenting all the information so that the board and citizens can make informed decisions. The medical community and the citizens are in agreement that the St. Clair County Health Department public health nurses receive comprehensive competency-based training and use protocols and orders of a medical director to provide safe vaccinations and testing at community events. Local health departments and community events are considered key access sites for vaccines that reach the vulnerable populations. Again, Dr. Nevins does not appear to support the public health nurses and he is not aligned with the citizens that receive the services in the community events. Effective medical directors at the local health department demonstrate the ability to foster a collaborative environment by building trust, empowering their team, by delegating tasks and responsibilities within the nurse or nurse practitioner's scope of practice to assure that appropriate medical standards are met. Dr. Nevin expressed beliefs and values on public health services offered St. Clair County Health Department that do not align with the medical needs of the citizens of the St. Clair County. His refusal to act as a medical director by providing collaborative agreement and protocols will result in canceled grants, lack of health department funds, and loss of staff and services. The medical community and the citizens in St. Clair respect and appreciate the health services that St. Clair County Health Department has offered. I urge the Board of Health to vote no to the memorandum and consider another medical director to provide the oversight for the medical services of St. Clair County. Dr. Nevin has a big interest in environmental health, and perhaps that's where he can best serve the county. Thank you.
Thank you. After Vicki will be Mike Lee.
Good morning.
Good morning.
As all of you know probably by now, I'm here trying to come with a win-win-win proposal. I think that this could be good news for all of us. And Dr. Nevin, you and I talked for 45 minutes. You know my heart, you know my spirit, you know my intention toward you. If I mention your name, it's with respect. I just want to get that out. I don't like when people are making deprecating remarks about other people that are serving the community that are irrelevant to the conversation. I'm going to say that. The good news, Dr. Nevin, there's no concern on your license. Your contract was already third-party reviewed. You have liability insurance, and so does the Board of Commissioners. You signed a contract knowing the job description, knowing the health officer is an experienced nurse in our county, and that you would work 16 hours per week while she is full-time. You may perceive doctors to be superior to nurses, but that's not true. It's just different roles. The goal is for everybody to work together to advocate and serve patients. You have an opportunity to negotiate a new contract as a consultant regarding solar, the landfill, PFAS. You can still write nexus letters for veterans that are medical, legal, political regarding quinism and PFAS. You do accept insurance and can use telehealth, so that's all good. This work is already your passion and full-time work. For the advisory board, doing the right thing and being pro-life after birth would necessitate a no vote on the memo. This is not about our current medical director, although his memo is regarding him. Removing services will not help our community. For the Board of Commissioners, we do have a critical mass of people, and I will say outside of the Health Department, opposed to this memo regarding elimination of clinics and fluoride. The Board of Commissioners needs to hire a medical director who is aware of the primary care needs of our county. And again, said respectfully and with hopes, as always, for bipartisanship. I try hard to see it through some other folks' lens. I would appreciate that you do the same. Thank you very much.
Thank you. After Mike Lee will be Monica Franks.
Mike Lee, I just want to say I want to see the fluoride stay in the water, and I'm a firm believer in vaccines. My father caught malaria off the coast of the Philippines in W2. I go in country, take a vaccine, and eat my pill every day, and I don't get malaria. So I'm a firm believer in vaccines. Thank you.
After Monica will be Linda Bush.
Good morning, everybody. My name is Monica Franks. I'm a registered nurse. I live in Marysville. I have no public health background, and but I am a member of the Blue Water Immunization Partnership. I was at last week's meeting, and it led me to have some questions about what was discussed. So I went to the bylaws, which were approved in June and July of 2025. Under Article 1, jurisdiction, it says, St. Clair County Health Department shall have jurisdiction throughout St. Clair County and shall serve all citizens. I would assume that all citizens mean the people of Yale and Algonac. I was wondering, and I may have missed this in last week's meeting, I don't know how these, or why these two clinics were targeted, but if I missed the explanation, I apologize for that. Dr. Nevin's memo said that he had discussions with local officials, state and county officials, and I was wondering who those officials might have been, and is there any documentation regarding those discussions? I was also wondering if any of the proposals in the memo are open for negotiations, such as, could we possibly, if we were going to keep these proposals, would it be possible to move the starting date? Because September 1st is only 2 weeks away, and that might be a little short. It might require a little bit more time to allow a smooth transition. I was wondering too if we could open the clinics and possibly they could be run on a part-time basis. If we can't do full-time, part-time might be an option. With regards to Dr. Nevin's 16-hour work week, possibly if he needs ancillary help, that might, if that's in the budget, that might be a suggestion, or possibly he could delegate some of his duties. I have other things to say, but my time is running out. Let's keep working toward a positive outcome. Thank you very much for your time.
Thank you. After Linda will be Karen Rucker.
Good morning, I'm Linda Bush. I live in Fort Gratiot, and I worked for 31 years for the Michigan Department of Health and Human Services and served 15 years on the Macomb County Mental Health Board. And I'm a little disappointed to hear that employees and staff and so forth our public servants aren't getting the recognition and respect that they need, and that their input, I feel, should be certainly considered highly. I went on the website, and I'm very disturbed that I couldn't see what your credentials are to be on this advisory committee. So I would suggest that you put that on so that the citizens who are viewing this know where you come from. And also tent cards. You indicated that you didn't want citizens to speak today because of your career. I'd like to know what that is, because citizens have careers too. In terms of community outreach, I was raised in Yale. I can't imagine any place that I've ever worked or volunteered, community outreach, a way to get our information out to the people who need it, was always at the forefront. We were always looking for funding. Wherever I have worked, I did contracts for the state of Michigan. We never felt an obligation or any interest in turning federal money back. And finally, I'd like you to think of people in Yale or Algonac or any communities where you're thinking of cutting funds who suffer from anxiety or depression. We often keep the emphasis on the physical health part, but you have to consider people's mental health, behavioral health too. And so to be able to get services in their community for elderly people who can't make the trip to Port Huron, for people who are isolated, don't have transportation, are depressed, maybe they could get to a clinic in Yale better than they could get to a place in Port Huron. If your mission is to provide services to the county, outreach is very important. Thank you.
Thank you. After Karen will be Ralph. I can't read, it's Gil something.
Hi, I'm Karen Rucker. I have been an RN since 1991, board certified in emergency nursing since 1994, and more recently completed my education for a legal nurse consultant. I am going to start out by saying I am very much in favor of maintaining the community outreach centers, if not even expanding them. Those serve individuals who, for whatever reason, cannot make it into town. I've noticed a difference just with moving the center off of 28th and Moak to downtown. It's more of a challenge. I would, ask anyone to imagine what it feels like to get on a public bus with an infant, a toddler, and a preschooler to come in for their immunizations, even if it's just a few miles. That said, I would also like to speak to the idea that standing orders and protocols are not safe. During my tenure in a hospital, I picked up shifts in an intensive care unit. The intensive care unit did not have a physician, only during rounding or if there was an emergency. We operated using standing orders and protocols. Literally, there was an instance where a physician had his hands on the patient, failed to hear the cardiac alarm going off, failed to look up and see that the patient was in a lethal rhythm. And when I brought the crash cart in, turned on the defibrillator and started pushing cardiac meds to correct the problem, the doctor asked me what I was doing. I said, I'm taking care of the VTAC that this person is in. So just having a physician present is no guarantee that appropriate care is going to happen. Nurses are trained to do this. Nurses maintain their training through continuing education, just as physicians do. At the hospital that story came from, the physicians that wanted to do, it was a surgeon that was involved in that case, and the physicians that want to do procedures have to have training for procedural sedation. Part of that is a one-and-done advanced cardiac life support. The nurses that are actually caring for the patients renew that every other year. So, as it was said earlier, there is a difference between physician and nurse. One is not better than the other. They're different, and both are equally as important and provide just the same, as the other. Thank you.
Is it Gilhooly? It's okay. Next up is Debbie Borges.
I'm Dr. Ralph Gilhooly. I'm a retired dentist from Fort Huron. I started my practice here in 1966. I'd like to touch on just a couple of things to keep my comments brief. The other night I talked a little bit about what's the process of fluoridation. And basically, fluoridating community water supply is having 7/10 of 1 part per million of fluoride in that water. 7/10 of 1 part per million fluoride in the water. In other words, if you can imagine my glass of water out here, I'm going to dump 1 million glasses of water into this tub, and then I'm going to take the glass with 7/10 filled with the fluoride. I'm going to add it in there. 7/10 of 1 part per million is the recommended fluoride level. What we don't often realize is our water comes, the whole Great Lakes Basin, our water comes from our Great Lakes. The Great Lakes have, and it's well known, a fact, that the Great Lakes levels have a 1/2 part per million fluoride already in the water supply. So to get fluoridated water in our community, all we're doing is bumping that 1/2 part that already comes in our water up to 7/10 of a part per million. We get all the wonderful benefits we get from fluoridated water. So I would maybe address the question to you as board members, as educators, as parents and grandparents. Are you willing to vote to saddle future generations of St. Clair County residents with high levels of decay, missing teeth, bridges, implants, orthodontics, you name it, all for the sake of removing 2/10 of a part of 1 million parts of fluoride? 5/10 is already in the water, 2 more tenths is all we're adding, and we get all those benefits. I would hope that you would consider that a highly beneficial program for the community. The other thing I'd like to at least touch on is Dr. Nevin's memorandum here to the county. The basis of his memorandum is basically a report from August 22nd of 2024, in which he cites National Toxicology Program reports. He talks about a program study that was issued in 2017, another study issued 2019, and it took them 8 years to put this study together and come up with some results. There were about 19 studies involved in putting this report together. Many of those were fairly flawed.
Your time is up.
Okay, thank you.
Thank you very much.
Yep.
After Debbie is Lily Prill.
Hi, my name is Debbie Burgoyes, and I am a resident of St. Clair County for about 30 years. Prior to that, I actually worked in St. Clair County. And I've noticed that the county is very far-flung, I guess is a good word for it. So it's very widespread. I am certain that many, many people never come to Port Huron. They just go about their days without being in this particular area. And as such, a side note would be, this is the first meeting, public meeting I've been to, and I've been to many, where there are little to no placards of who is sitting on this board right now, or this panel. So I'm, my part of the county, I don't know who everyone is, okay? Additionally, I saw Dr. Nevin's letters that he wrote, and in there I noticed quite a bit of information about people going to their primary care physician, and that the county health department was not intended to replace primary care physicians. Well, one, primary care physicians come with health insurance or people that regularly go to the doctor. And the health department, in my opinion, would be somebody that serves those that do not have that access and are protecting the public from people who are not regularly seeing any physician. Additionally, when my child was an infant, our primary care physician instructed us to go to the health department for well baby immunizations. Now, where I live, am I going to haul, just like somebody else said, a baby and a toddler on the bus up here to Port Huron? I'm kind of shocked that that's the opinion that people should be doing to protect the public health. Furthermore, if the public health department of this county has the intent of being Port Huron centric, then perhaps what needs to happen is that it is not a county health department, it is a Port Huron health department. And in that case, is Port Huron ready to foot the bill for the Port Huron Health Department? And the county can go do what it needs to do on its own. Thank you.
Thank you. After Libby Prill will be Carol Miller.
Morning. Oh, hang on here. Public health services are being misinterpreted as free healthcare services, rather than the analytical and evaluative support for developing public policy. I support outreach and I support vaccines, and most of the outreach will not be affected. Vaccines will continue. The issue is whether primary care is going to be the primary role of the public health system. I think grant Dr. Nevin some input into hiring, evaluation, training, and termination of health department staff, and increases hours to provide adequate time to review their protocols and efficacy. There were staff complaints that Dr. Nevin does not trust their professional training, but what I saw on Thursday night is a staff that does not show respect for his medical expertise and the risks that he absorbs. Staff members chattered throughout public comment, laughing and making rude remarks to and about those who expressed support for Dr. Nevin. They laughed and made rude comments while Dr. Nevin explained his responsibility to the litigation of the new energy ordinance. It's indicative of the disconnect between the health department staff and the public, and it was made clear by staff dismissing the public concerns for solar data and battery facility impacts on residents, as well as their disregard for public concerns for fluoride in the water. The most telling action was the number of health department staff who stood and left the meeting when the members of the Health Advisory Board were asked to comment on their ideas for solutions. The staff demonstrated the hostility that Dr. Nevin faces in his desire to monitor the use of his license and bring county health services in line with the statutes. And I still have a minute left. So I just wanted to point out, I know that I just recently posted a summation of what the cuts and what will remain. Largely, outreach will remain. What's really, in conflict here is the role of these health clinics. I think that there's viable solutions. I don't necessarily see public health being compromised. I live in China Township. Having a clinic in Yale and a clinic in Algonac and a clinic in Port Huron doesn't do me any good. If you really want to really address the need for public services, then let's do that. And let's do that by coordinating some services with some of our other local health providers, whether it's private practice or some of these minute clinics that we have now in pharmacies. I get my vaccination. I was just at my doctor on Tuesday, but I, get my vaccinations through my pharmacist at VG's. I mean, there's a lot of different ways to address this where no one's going to suffer. We just have to be willing to work together, and we have a health department staff that many of you are not willing to do that. Thank you.
After Carol will be Jimmy Dadu.
Good morning, board members, Ms. King and Dr. Nevin. The first thing I was going to talk about was meeting location. I really am glad to see that you're all here. I know you have the capability to videotape these meetings, so hopefully you'll stay here and start videotaping the meetings.
Meeting decorum is the next thing I wanted to bring up. I was concerned by the lack of professionalism displayed by several health department employees and some of the people in the audience during the meeting. As these sessions are meant to provide the public with an opportunity to share opinions, I respectfully suggest that stronger measures be maintained to maintain the quorum on future meetings. Again, we're still hearing snide comments, clapping, and everything else. Monica, you have a gavel. I would suggest that you continue to use it. If the board chooses to relocate the commissioner's room, as I said, this would be a perfect opportunity to not only put your placards up there, but to also to tape the meetings. Several remarks were made by a board member, including statements such as messing with kids and comments questioning the trustworthiness of nurses and their adherence to scope of practice. Appeared inappropriate and counterproductive, particularly when directed toward Dr. Nevern. Additionally, given this individual's past disciplinary history involving serious licensure violations, such comments raise serious questions of credibility and propriety. The board, by its very function, must model professional conduct and focus its efforts on addressing public health concerns. Personal attacks or inflammatory statements undermine both the board's integrity and public confidence. If a member is unable to adhere to these standards, their continued participation should be reconsidered in the interest of effective governance, and resignation or removal may be warranted. This is not a primary care office, but a public health department. For those needing to know what the definition is, please go back and re-listen to what Dr. Nevin addressed as what the definition of the public health department is. We need to think outside the box for solution. That is what's needed. Again, if bad behavior continues, this would warrant dismissal of that individual. There are significant risks associated with how professional licenses are being referenced and applied in the context of board activities. Specifically, the current practices may jeopardize the licenses not only of Dr. Nevin, the nursing staff, and Liz King as well. Such exposure not only threatens the careers of dedicated professionals, as many of you are, but many also subject the county and its citizens to substantial legal liability such an adverse event occur. It is imperative that the board conduct its proceedings with professional transparency and respect. And I've got 20 seconds left. So what I'd like to say is, as far as fluoride goes, I know back when I was young, and many of you people weren't even born then, that we had people come and do fluoride stuff and teaching to us. Also, we had vaccinations come from the health department to the schools. We didn't have to go to the doctors to get them. So hopefully that'll be thinking outside the box. So thank you.
Thank you. After Jimmy will be Patty Samar. Jimmy D-A-D-O? He left? Okay. Then Patty, you are up. And after Patty will be Cynthia Blackstone. Blackston. Thank you.
Good morning. My name is Patty Samar, and I'm a resident of the city of Port Huron. I am beyond concerned about Dr. Remington Nevin's memorandum of August 1st that outlines a vast number of health department services that he wishes to discontinue, most especially those concerning closing out-county clinics and eliminating county health care outreach programs. My county commissioner, Carrie Angie, explained to me that Dr. Nevin is concerned about liability and malpractice insurance and concerning his medical license due to standing orders that are required to be placed under his name. I would point out to all of you, everybody in the audience included, a number of facts. Michigan has 83 counties. All of them are required to have a licensed medical director, while all 83 offer a wide variety of services depending on their community needs. I'm sure it is safe to assume that at least some of them offer similar off-site services as St. Clair County does. Before you make a decision to approve Dr. Nevin's recommendation to terminate healthcare to a wide swath of community residents, most especially vulnerable seniors and youth, it would behoove you as committed public servants to do your research, as so many of you like to say, and find out what best practices and standards of care are in place statewide to address Dr. Nevin's concerns. I'm sure he learned in medical school that you don't throw out the baby with the bathwater. Dr. Nevin has been our medical director for at least 2 years. He accepted this job knowing and understanding liability and medical malpractice issues. And if for some reason he has learned during the course of doing his job that something is untenable to him, I would suggest that instead of this board tossing out healthcare services that are accessible to residents countywide and apparently are being paid for with a grant, so we aren't even paying for it out of our own pockets directly here in our county, that instead you toss out Dr. Nevin and find someone who seems exceptionally preoccupied with the fear of losing his medical license. I would implore of you to address all of these issues with the county's legal counsel. If the county policies are deficient, they should be adjusted rather than discontinue critical medical services being provided by a grant, no less, to our residents. And finally, I appreciate all of your service to this board, although as many others have stated, I wish you would identify who you are and buy a name placard or whatnot. I know this is difficult work, but I implore of you, please believe in science. Thank you.
Thank you. After Cynthia will be Deb Roberts.
Hello. Hello, I'm Cynthia Bankston. I'm a registered nurse, retired, and I've worked in all areas of the hospital. But I just want to say that I appreciate the health department and any other department that's connected to it, like the teen health centers. And I rode the bus here today. They were a little late, so was I. Because my son has it at work. But anyway, I'm just saying the bus system is not always on time. So if you have a scheduled appointment at the health department, you may not get there on time. I tried it out today, and I found out. And I want to say that bringing up people's past history that doesn't even apply to their position, like 20 years ago. I can say when I was younger, I didn't like children, but I now teach children's church, and I love them, And when I was in 6th grade, I was pulling on girls' hair and being a little bossy thing, even though I was kind of shy, but I'm not like that right now. So don't bring up people's past or what they used to do and how they were. Also, I want to say that I'm not for the cuts. I'm not for the memorandum. I'm for the staff. I'm for the nurses and those nurse practitioners that have been doing such a fine job. And they have been continuing to do that job. And I'm for the outreach because some are coming to the Field Day and Music Festival on August 30th in Lincoln Park. And it's because there's going to be a lot of people there and they're going to be reached. Blood pressures, health information, for mental health, all those, it's important, it's needed. And I want to say real quick, if you be quiet and say nothing, and I used to be a shy person, not saying anything, nothing gets fixed. If you're going to be quiet, and if you want to call when people speak out about something because they're passionate about it, being bossy and all that, that's not what it's about. They're just trying to get their point across for people to just understand where they're coming from. And also, I don't have enough minutes to say what I'm going to say, so I'm going to leave that, even though I've kept being awakened by it. But anyway, I'm going to say it real quick. Dr. Nevin, he had put in a letter of resignation. Then the commissioners, I guess somebody encouraged him to stay. I would say it's open to you if you're at risk, you think your license at risk, to put in another letter of resignation and let somebody qualified to deal with the public health. That's what I would say. You're still open to it, no pressure, and you can do that. But I really appreciate the Health Advisory Board because they do listen to the people. Hopefully, they will listen to the people because you all, maybe 10 or 11 people, support thousands of people, not just 10 or 12 or 20. You support the whole county.
Thank you.
Just think about that number.
Thank you. After Deb Roberts is Kimberly, I don't know if it's is it Raleigh maybe, Kimberly? Robin, Raleigh? I'm not sure.
Hi, I'm Deb Roberts. I'm a citizen of the St. Clair County for 71 years, and I'm a retired RN. I think everything's kind of been said. I thought I'd do something a little outside of the box and read a poem. Unsurrendered, it seems our lives must be more than something out of nothing, more than just survival, more than just existence. Our soul substance lies in our actions. Unsurrendered, we take to heart commandments to not covet, lie, or kill. How naive, we assumed that included everything, not convenience, greed, or will. Power, money, now so godlike. We stand on coins and pet our IRAs. We fervently pray that this trade out of fear as we budget our caring will not cost us. Unsurrendered, our stubborn hearts defy cunning games that don't lean towards honor, joy, or blessings. Holding our breath, we struggle as we listen to our inner voice of reason. We hang, our fingertips slipping as we carefully weigh what matters. Our truth of being, our connection to make a difference. It's getting harder to ration our caring, easier to just let go. Unsurrendered, generous hearts lean toward grace. Extremists smile, defensive, threatening sneers, seeking justice. They think they know the secrets. We search the faces of our leaders. Where is balance, the pain, the plan we sense? Behind the smiles, deceit, a sickening syrup, seamless ceiling clinic doors. Our purse or yours? Care for the poor? Your antipathy roars. We stand unsurrendered. Thank you.
Thank you. After Kimberly will be Reverend David Stensky. And Kimberly, is that what's your last name?
Raleigh, like North Carolina.
Okay. Thank you.
Good morning. My name is Dr. Kimberly Raleigh, and while I am not a resident of St. Clair County, I serve as the interim executive director for the Michigan Oral Health Coalition. Our coalition brings together clinicians, educators, community organizations to improve oral health for Michiganders by focusing on prevention, access to care, and the vital connection between oral health and overall health. I'm here today to strongly support maintaining community water fluoridation. At the recommended levels of 0.7 milligrams per liter, fluoridation is safe, effective, and recognized as a major public health achievement. It is endorsed by the CDC, the American Dental Association, the American Academy of Pediatrics, and the World Health Organization, amongst many others. The science is overwhelming. Fluoridation reduces cavities by about 25%, saves families and communities millions in dental care costs, and improves oral health across a lifespan. Now, let me address the claims that fluoride lowers IQ or causes neurotoxicity. The studies behind this claim were conducted in places where fluoride levels were significantly higher than what we use here in the United States, often 3, 5, and even 10 times higher than the recommended level of 0.7 milligrams per liter. At those elevated levels, above the WHO's maximum guideline of 1.5 milliliters per liter, health concerns can indeed arise, but that is not what we are talking about here. Here in the United States, we recommend that levels of 0.7 milligrams per liter is both safe and effective. At this level, there is absolutely no credible evidence that fluoride harms brain development, lowers IQ, or causes neurotoxicity. In fact, the real evidence shows that the real threat to children learning is untreated tooth decay. Cavities are one of the leading reasons that children miss school, and if fluoridation were removed and decay rates increased, we would see more kids in pain, more missed school days, and more barriers to learning. That doesn't lower IQ directly, but the common sense reality is this: tooth pain keeps kids out of school, and nothing slows learning faster than that. If we want to return to common sense, then let's act with common sense. Community water fluoridation works. It works for kids, it works for adults, and it works for communities. And it's worked for more than 75 years. That is the real common sense. According to Michigan law, if fluoridation was adopted by a public vote, it can only be rescinded in the same method, a public vote. Commissioners acting otherwise may be exceeding legal authority and stepping outside democratic process. On behalf of the Michigan Oral Health Coalition, I urge you to maintain a community water fluoridation for the health, well-being, and the economic stability of St. Clair County residents. Thank you.
Thank you. Gary Lokers will be next.
Hello, Board. Thank you for letting me be here today and for taking your time. My name is Reverend David Stensky. I'm a local pastor. I'm also a chaplain at a local hospital. I'm a proud resident of the South Park neighborhood. I just wanted to let you know my perspective. I visit a lot of people in a hospital, nursing home, and in the community. And vaccines are very needed. I see a lot of people this year in the hospital that are in there because of the flu, RSV, COVID, and pneumonia. Now, these are all preventable diseases we have vaccines for these. Now, you pair these with heart issues, heart disease, and other health ailments, these could be deadly. I've seen people pass this year from them. I've done more funerals this year than I ever have done in my years of ministry. And if we take away this, if we take away vaccines, if we take away outreach and limit vaccinations, I hate to see what it does to our healthcare system. I really do. I'm tired. I've seen so much death this year. Just this year alone. I'm tired of it. We need to be vaccinating more people. And we don't understand it. I mean, you don't see it, but you see it in the hospital. It's on the rise. And if you think if we take these clinics away, that the people that aren't sick won't go to the hospital, they will. They'll walk into the emergency room, and our healthcare system will collapse. I remember during COVID, people were in beds and hallways because we didn't have any place to put them. So think about that. We need these vaccine clinics. We need the outreach. People need to get vaccinated. Thank you.
Thank you. After Gary Lokers will be Chris Bardo. Oh, Gary left. Chris?
Good morning, everyone. Chris Bartow, Clyde Township. I cannot speak to the health department issues. I'm not educated on that. Unfortunately, I am very educated on the industrial solar issue. And in this county, to this day, we've been fighting this for 2 years, and I can walk up to people in Walmart, this is my whole life now, and ask them if they know about the industrial solar issue, and they're like, what are you talking about? So what this is in Fort Gratiot is from Kerrigan to Metcalf, where I live on my farm, from Parker Road all the way to North Road in Fort Gratiot, almost 600 acres in Clyde Township. There are solar leases of thousands of acres across St. Clair County. We just found out Detroit Edison, there are leases in the area of like Rattle Run in Gratiot, Rattle Run in Wadhams. There's a huge facility proposed. There's leases signed, not proposed, excuse me. Leases are signed in Yale. In Birchville Township, which is across from my farm, there's a Ranger Power lease for 200 acres. Potentially, there could be a 4,000-acre solar facility that I would be surrounded by. I don't think people understand the health issue. People have kind of downplayed and thinking Dr. Nevin is spending too much time on this. I would hope that everybody would try to research this issue and don't just Google. I do not do good research. I'm a bit of an idiot, but I know people that deep dive into this. You can't just look at what the solar companies are saying about these issues. Ranger Power has a book this big in Clyde Township. Fort Gratiot has said yes to this. Clyde Township, thank God, has done their research. Our planning commission did their due diligence with this, and that's the only thing that's holding up right now. Like I said, potentially 4,000 acres right around me. So it's Fort Gratiot, it's Clyde, it's Birchville, it's Grant Township, it's Worth Township. It's the industrialization of St. Clair County, and it's scary. It's your property values, it is your health, it's your mental health, it's your physical health. And people just don't realize what's going on. When I go out doing petitions, talking to people, they're like, I'm for solar, and they bow up. Well, I'm a 35-year vegetarian. I'm all about saving the environment. I live on Metcalf. They just cleared 80 acres, clear cut it, of the trees. There's a solar lease on that property. It's not part of the property, but what happens here, my other neighbor told me he was approached for battery storage. And now we just had a big fire in Clyde Township on North, a farming incident. Clyde, Fort Gratiot, and Birchville responded. It took them almost all day to put out this fire. Solar
time is up.
facilities, I can't even
Thank
imagine
you.
them being able to handle it. Please look into it, everybody. I'm sorry, I'm not speaking about the issue at hand.
Okay, is there any other public comment? Anyone else that wished to speak that didn't sign in? You didn't check yes to speak. So Diane, come on up.
Something I have never done before. And just to clarify, someone who said it's not coming out of your pocket, I beg to differ because I'm a taxpayer and I'm paying for these. So just to clear that up. I'm Diane Hewlett from Riley, and Dr. Nevin has been attacked, but it takes two in this area. I have watched the advisory meeting for several months now, actually years, and how, I'm sorry, Ms. King, I'm going to call you out. You have said that you wanted to remain neutral and not take sides. What I saw last meeting was anything but. I would describe it as a coup. You may be great at what you do otherwise, yet I question your motivation behind this. What I saw was a manipulation of your staff. Someone riled your staff versus informing them. And they got them to react, but playing these games makes you look bad, in my opinion. It puts this board in an awkward position. So we have before us a man who has extremely qualified to lead us into the future. It is okay to disagree, yet this is what I saw, my observation only. As the county, they use Dr. Nevin's license. Then you proceed to tell him how to use said license. Your staff shared half-truths. His 16 hours is a contract, people, not for, I believe, 1 to 2 facilities. They have added 3 and 4, but you want him to work 32 hours and get paid for 16. That's just not right. It appears that a very, very hostile environment has been created for Dr. Nevin to work in. He has taken abuse, criticism, and never flinched. He came to our county to help us and to be with his parents. But now he appears to be more confident than ever. It is not about mistrusting the staff, it's protecting his license. I don't understand why we just don't give him more hours and give them the control to work the job that he was hired for. Then you can have all the clinics you want. A lesser man would have walked a long time ago, but it appears he isn't going anywhere. It makes me wonder what happened to the last medical director. It seems to me this situation could have been handled without drama by simply working together to perhaps hire this proposed doctor that you guys, that the board mentioned at the last meeting. Your group couldn't even follow simple directions, and I see they're still not from this board, by not applauding after each speaker, which I see as a total disrespect to this board. At no time did you direct your groups to honor Madam Chairperson's request that speaks volume for your leadership. Perhaps a sergeant in arms is needed, whatever. This board is smart, and they don't need me to tell you any of this. And by the way,
time.
Last thing, the board of
Your time is up. Thank you,
board
Diane.
of directors.
Who else wanted to speak? You forgot to check the box? Oh, yep, you did not. Yep. Trey, you wanted to speak as well?
Good morning, Board of Health members. Thank you for your service. My name is Susan Amato. I'm retired as Director of Health Education and Promotion for the St. Clair County Health Department, and I live in Marysville. Dr. Nevins stated in previous Board of Health meetings that his first duty as medical director is to do no harm. What is discontinuing clinical services at branch offices but doing harm? If there is a risk of harm or compromises of safety, it should be fixed rather than quitting a program over ideology. Let's hear a reasonable rationale for this consolidation of services. The first duty of public health is to deliver health promotion, disease prevention to all county residents. It's obvious there is a disconnect between this medical directive, and the mission of the health department. I come before you with 50 years of personal and professional experience with the health department. First, as a 26-year-old mother utilizing the immunization services, and was immediately impressed with the skill, efficiency, and caring demeanor of the staff. I continue to utilize the services for my family's immunization needs. Then, serving as Director of Health Education and Planning for the department for 23 years, I worked with the nursing staff to deliver education and health promotion activities within the county. It is this population that I come in support of today. Public health nurses are trusted healthcare professionals and are highly proficient at giving immunizations and conducting diagnostic testing. They should not be relegated to only providing education and counseling. How can we remain ready for the next pandemic, a measles outbreak, bird flu, or the next public health emergency if we do not maintain a well-trained, experienced staff of public health nurses, clerks, and support staff? Public health workers are our heroes, working diligently to keep us informed of emerging health threats and maintaining preparation to meet those needs with evidence-based best practices. Their work may not always be visible, but its impact is undeniable. There's no reason for this directive to be implemented in 2 weeks, making it harder for parents to protect children from diseases like measles, flu, RSV, and leaving vulnerable older adults with limited access to flu and COVID vaccines is contrary to the public health mission. Creating barriers for residents to access services such as STI, HIV pregnancy testing also goes against this. Call this directive consolidation, but it's actually limiting access to vital health promotion services in our community and leaving us unprepared to meet their needs as well as emerging.
Your time is up.
Thank you.
Thank you. Trey? Is it Smith?
It is.
It is. Thank you.
All right. Good morning, everyone. Thank you very much for your time. And I think I'm going to say something that's going to speak to neither side, but it's going to speak to the third group of people. What I'm going to say is what we don't want to say really out loud, which is the truth is that our community has gotten lazy. We become a bunch of professional complainers, waiting on the government to do what we can only do for ourselves. Every time a service is cut, every time a program slows down, the first reaction is always outrage, finger pointing, and endless meetings of why won't they take care of us, when the truth is, why won't we take care of ourselves? The truth is no government, federal, state, or local is going to save us. They write policies, they shuffle money, they make promises, but the only thing that changes is a community, and when it organizes, take ownership and build solutions with their own hands. As Malcolm X once said, the church to a religious community said, y'all need to stop singing and start swinging. It's not just about fists, it's about action, it's about moving to transformation, it's about shifting from endless prayer meetings without work, yet faith that prove that we can work together and stop begging for rescue and simply start demanding responsibility from ourselves. We need to advocate for ourselves with the same energy that we complain about what government does or does not do. Imagine a packed room full of people that actually come together to write a grant or to fundraise or to organize something versus coming to say, you're not doing what we want you to do versus we can do it better ourselves. The future of this community will not be written by what the government does or does not do. It will be written by what we build. I'm going to give you 3 names that you may not remember. Alex Crittenden, Isla Shoulders, and Mr. Portis, Pastor Portis, 3 individuals that started initiatives in this community because it wasn't around and the government wouldn't do it, because they said, we'll do it ourselves, we'll organize, and we'll make it happen. The fact remains that we have more than enough resources and willing people and gifted people. We have the Blue Water Immunization Partnership that started because there was a lack of services, and it didn't beg the government to help. But if we partner with the existing agencies, we can bring what we want, how we want, control it, and we won't have to wait on anybody to do anything. It happens in every other community of people that care. Because we care enough, you're telling me that if they cut down a service, you're really going to sit there and watch your child die? No, you're going to find a way to make it happen. And as for this less fortunate community, most of the people that I see in our community, they may not make good health decisions, but they tend to always get their hair done and nails done and never have that problem. So the truth of the matter is this: let's provide ourselves with opportunities to work together and figure out where the gaps of services are, and let's own it, and let's partner and show the government that we can do better than they can. Thank you.
Thank you. Somebody else had their hand, yes. Did you sign in? Okay, that's okay. Yeah. I just need your name.
My name is Brandolyn McDonald. I'm a registered dental hygienist. I live in Marine City. I graduated from Algonac High School, and I had the privilege of going to Baker in Port Huron. I am familiar with our community and the differences that we see between economics and the different things that we are exposed to. I did not hear about this meeting until yesterday when I received an email, and I thought, I have tomorrow off and lots of things I have to do, but I would like to take the time to hear what our community has to say and possibly, hopefully, just offer some information in my own experience. I have been a hygienist for nearly 20 years now, and in the dental field for a little bit longer than that. I find that people need to take their own responsibility in their dental health, and not everybody does that. Something that is helpful is that we are able to offer public tap water with fluoride. And I know it's a huge subject. I know everybody is very passionate about their side, but I've seen what it does and what it doesn't do for people. I can talk to you all day long about how important it is to floss. Everybody knows that. Is everybody going to floss every day? Let me see those hands. Right? It's a very small amount of people. But we have the opportunity to offer something that is going to benefit everybody else. Also, we're looking at children. Our purpose is to help our patients in their future. It's not just today. A child learns what their parent teaches them. They are not born with bacteria in their mouth that is going to be periodontal disease, that is going to be cavities, that is mainly given to us by somebody that is our caregiver that has active decay or active periodontal disease bacteria in their mouth. And then they are learning the habits, they are learning their diet, they also have other factors. There's so many parts that go into this. So everybody is different, and everybody that's in my chair, I have to look at that individually for them. I have to decide if they are on well water, if it's better for them to supplement some kind of fluoride because they're more at risk for things. We look at lots of different factors. And the one thing that we have in common that we've seen over the years that is positive is the small amount of fluoride that's in there is beneficial for everybody. Side note of that, I'm a very natural loving person. I'm a special needs mom. My son has a genetic disorder, and I have to look at everything that's important for his body as well. So we do a lot of natural things. And people are going to say fluoride is not natural. There's a lot of science if you guys really want to get into it. It's not just a TikTok discussion, okay? Sorry, I'm so nervous. As far as the health department, I honestly had no clue. I really did not know this was a discussion that was happening in our area right now. And I'm on a parent advisory board. I am a soccer coach. I talk to a lot of people in our community. And I am surprised that this is not something that's being talked about more. I will say I love our health department. I appreciate everything. I love it. Thank you.
Thank you.
Good luck.
Okay, I have 3 letters to read into public comment. I am writing to express my deep concern regarding the potential closure of the school clinics and the way the issue has been addressed thus far. It is clear that there is significant community support for keeping these clinics open, yet I feel that this outpouring of concern has not been adequately acknowledged or weighed in by the board's decision-making process. Closing these clinics would have serious consequences for health, well-being, and accessibility of care for your constituents, especially children and families who may face barriers to receiving services elsewhere. These clinics provide an essential resource, and their loss would create lasting negative impacts across our community. I urge you to deeply consider these consequences before moving forward with any decision to close them. Additionally, I want to express my disappointment with the scheduling of board meetings at 9 a.m. As someone who works typical business hours, this time may make it nearly impossible for many working residents, including myself, to attend and voice our concerns in person. The timing of these meetings unintentionally excludes a large portion of the community whose input is crucial. I respectfully ask that board consider scheduling meetings at times more accessible to working families in the future. The decision made by this board directly affects the health and well-being of the community, and I strongly encourage you to take into account the overwhelming community support for keeping the school clinics open, as well as the need for fair and accessible public input. Thank you for your time and consideration. Violet Phillips, Cotterville Township. And so I knew I could get that one in 3 minutes. These next two, well, this one I can too. I respectfully request this email. Okay. My name is Jennifer Mahalik, and I am a Port Huron. I live in Port Huron and am a lifelong county resident. I'm a recent retiree of the St. Clair County Health Department with 30 years of service. I recently submitted a letter to the Board of Health for the special meeting held last week. I will not rehash my points as you already have those. However, I will reiterate that I strongly support the health department's keeping things as is. I ask you to please not support or recommend any of Dr. Nevin's proposed changes listed in his August memo, specifically not eliminating the adolescent health centers where those services are very much needed, and to not discontinue providing health services at community events where the most vulnerable populations are reached and will be impacted. Regarding his latest mission to advocate removing fluoride from municipal drinking water systems, why focus on another public health matter that's not broken? Fluoridation is one of the top 10 public health achievements of all time. If fluoride can cause health issues he references, where are these county cases? Wouldn't we see them by now? Wouldn't doctors be reporting those health concerns? Wouldn't more people be sick at levels were considered toxic? Wouldn't the EPA be involved? If he wants municipalities to consider removing fluoride from the drinking water, what about the natural occurring fluoride in well water and many of our residents have? How does that work? As a medical doctor, why isn't he listening to experts in the field like our dentists, periodontists, orthodontists, or agency experts like the American Dental Association, American Medical Association, American Academy of Pediatrics, etc.? I ask you on this issue to please not support or recommend removing fluoride. Much of the robust research and studies need to be done on this matter. There are many other initiatives that the medical director could focus on that support local public health. A few examples include working to support the county's Community Health Improvement Plan, CHIP, where there are 3 established priority areas: mental health, substance abuse, and obesity, and related health behaviors. Preparing for the next county community health needs assessment, working with partners on the healthcare gaps in the county, lack of OB/GYNs, general surgeons, ears, nose, and throat doctors, primary care, etc. Working with community partners on affordable housing issues, working to ensure all our residents have health insurance, especially as Medicaid cuts occur and other insurance costs rise. Looking ahead with agency partners at our growing aging population and working to support the healthy aging of our seniors. These are just a few. Dr. Nevin, study the social detriments of health as they tie in here and matter. Work on improving health outcomes of our residents. Focus on these things, some of these things listed, versus working to remove us backwards, and stop trying to dismantle our local public health department. Thank you, Jennifer Mahalik. Hello, my name is Melanie Dunsmore. I'm a bachelor's prepared registered nurse. I retired 3 years ago from St. Clair County Health Department, a position I held, loved, and believed in for 23 years. I have also been a resident of St. Clair County for 62 of my 65 years. I'm writing to ask that you not agree to Dr. Nevin's terms stated in his memorandum to eliminate school-based clinics. He states it's due to liability and safety. Clearly defined standing orders outline exactly how a nurse will proceed with various medical situations utilizing algorithms and narratives. This is not a new concept. Nurses have always worked utilizing standing orders. Prior to working at the health department, I worked in the hospital, plus worked a second job in nursing home to help pay college tuition for my son. In the hospital during the day, a physician came in to make rounds, then left. During midnights, the doctor wasn't there at all. In the nursing home, I never saw a physician during my shift, which was weekends. We worked utilizing the orders written and approved by the doctor. I believe there are 2 nurses and a nurse practitioner on the Board of Health. I know each of them very familiar with the concept because they have worked in the exact same way. Health department nurses do not deal with the same patient acuity and variability as hospital nurses. It's not the same focus. Health department nurses, whether at the main or school-based clinics, are not removing a kidney or providing open heart surgery. Parents sign a consent to release form and allow the health department nurses to provide services. Testing on site consists of CLIA-waived testing, which your nursing representation on the Board of Health can attest that CLIA-waived testing is the basic of basic. Having a public health nurse working within the school is not a new, uncharted concept. I can remember in elementary school, public health nurses came to our school to give injectable vaccines, including the polio vaccine on a sugar cube. Now, more than ever, nurses are needed in the schools. More and more children require medical intervention throughout the day for diagnoses such as asthma, diabetes, attention deficit disorder, and so many more. Social work services are also essential in the school for many reasons, obvious reasons. I was present at the Board of Health meeting last week. The nursing staff that spoke, including myself, were not speaking and pleading for reconsideration for themselves. They, including myself, were there on behalf of the community and students. Please, let's not go backwards. When we lose the grants, we will not be able to get them back. They will go to another county whose medical director trusts the process. Let nurses and social workers continue to provide the same high-quality services in our school-based clinics. Dr. Nevin has been medical director for the past 2 years, and during the time and long before he accepted the position, never has this been an incident to cause distrust. One must wonder, what is the true underlying reason? If you are uncertain about the safety, take a road trip and visit some of the clinics before you make a decision. You will see that each clinic has a copy of standing orders readily available, and emergency supplies are also available when and if they are needed by the nurses until 911 arrives. Sincerely, Melanie Dunsmore, RNBSN. This communication is in response to Dr. Nevin's memorandum, proposed consolidation of all St. Clair County Health Department community medical services to 2 Port Huron sites, specifically the main health department building and the Teen Health Center on the campus of Port Huron High School. In the memorandum, Dr. Nevin states, while using his, quote, medical specialty judgment, unquote, that the reason for the consolidation is to, quote, ensure the appropriate medical standard of care is met, unquote. In order to accomplish this assurance, Dr. Nevin further proposes the revision of standing orders and nurse practitioner collaborative agreements in the modification of the state facility license and private and public billing agreements and registrations. As a former St. Clair County school nurse in both Port Huron and Marysville school districts, I never saw a medical director in 8 of the schools I rotated through on a weekly basis. As a float nurse in a hospital, I worked in very clear standing orders, and there were no medical directors on the unit. As a public health nursing supervisor, I listened carefully to Dr. Nevin's speech at the last board meeting, and I heard him state his credentials, but did not ascertain that he has had actual public health experience. He cited some public health laws, his academia role teaching public health classes, his degrees in public health and epidemiology, his work in the military, etc. I did not hear that he has had experience actually working in the public health clinics or in his as in a medical director role for the state health programs, state public health programs. While it is apparent Dr. Nevin possesses the qualifications on paper to fulfill the role of county medical director, it is my opinion that perhaps after working as the St. Clair County Health Department medical director for the last 2 years, he has yet to grasp the importance of empowering those responsible for delivering public health medical services. Furthermore, it is my opinion that Dr. Nevin is trying to convince the board members and public that the medical services provided in community clinics and events throughout St. Clair County by the health department, professional nurses, are somehow subpar to those services provided by the same professionals at the main health department. In truth, medical services at on-site, off-site clinics and events are provided under the exact same standing orders, state mandates, and professional scope of practice by the health department nurses and nurse practitioners, no matter where the services are delivered. The St. Clair County Health Department continues to meet state accreditation standards, both on-site and off-site. It has been my experience working in the supervising public health clinic services, including STD, HIV, family planning, and adolescent health centers for 12 years, along with WIC Clinic for the last 8 years of my career, and contrary to what Dr. Nevin is suggesting, the St. Clair County Health Department has always been a progressive health department that has been highly lauded around the state by other health departments and public health officials as a leader in creating the implementing strategies and ways to provide efficient, accessible, and safe services, both medical and non-medical. Examples being implementing billing for STD HIV services, integrating immunizations and maternal health programs and services into the WIC program, starting a fluoride application program for WIC children in order to prevent bottle carries, and collaborating with both professional nurses and birthing unit at the local hospital to enroll new mothers and babies in WIC and other health department services such as immunizations and maternal health while the mother and baby are still in the birthing unit. Furthermore, I believe Dr. Nevin believes the expansion of the medical services off-site has been more recent development, even though there have always been off-site public health clinics with medical services such as vaccine and simple CLIA wave tests provided by the public health nurses via standing orders approved and signed off by a part-time medical director. At the last Board of Health meeting, it was encouraging to listen to over 60 impassioned community members and many professionals, including school superintendents, health department nurses, nurse practitioners, physicians, and state representatives for school health clinics, speak against the elimination of the school medical services provided by the registered licensed nurses and practitioners at clinics located around the county. Just as nurses provide appropriate care under medical directors in hospitals, schools, nursing, and assisted living homes, the St. Clair County Health Department nurse and nurse practitioners are also providing services in the community where those services are needed. They are consummate professionals who spoke to the board members not for themselves and their jobs, but for the people they serve and far reaches of St. Clair County, as well as the two main clinics in Port Huron. I respectfully implore all of the members of both boards to consider keeping the community medical health services where they are currently located and perhaps encourage Dr. Nevin to work collaboratively with the health department staff so he can be comfortable delegating the needed medical services in the off-site clinics via his standing orders, continual staff training, and professional conduct. It is important for Dr. Nevin to feel confident in his medical director role, knowing he doesn't have to be present for staff to provide an appropriate standard of medical care in order for a trusting and professional relationship to exist between him and the staff he wishes to lead. Thank you for your consideration. Kathy Blatto, RN BSN. These were ones that were submitted we have another whole stack of emails that we received from people, but these were specifically to be read in. Okay, minutes from July of 2025. Where are we at for time? We have 9 minutes.
Motion to approve.
Second. It's been moved and seconded to approve the minutes from July of 2025. Any further discussion? All in favor?
Aye.
Opposed? That carries. Budget to actual.
There's nothing remarkable to point out. If there's questions, please ask.
Motion to receive and file as presented.
It's been moved in second to approve the budget to actual in transaction registry. Any further discussion? All in favor?
Aye.
Opposed? Liz, are there further correspondence other than this pack?
There is your quarterly reportable disease update. That's included in there. If anybody has questions, I'm sure Dr. Nevin could go into those, but we provided that. That again goes out to, that again goes out to our providers within the community. It's posted on our website, done quarterly and then annually.
Ms. King, is this a time that maybe Dr. Nevin should comment on those things? Or wait for his own? Speaking to Ms. King,
I would leave that up to the board and Dr. Nevin.
because I think that's part of his role. We'd like to hear what he stated, if there's any comments about disease or these things that are affecting the county, sir?
Kevin, are you asking me to comment on the reportable disease report?
Correct.
There's nothing of note.
Beg your pardon?
There's nothing
There's
noteworthy.
nothing of note.
Okay.
Okay. I'm sorry, go ahead.
Additionally, in your packet is our feedback report. So that's our client satisfaction survey. And I believe that is from January 1st to, I think, July 1st. And as you know, for those who have been on the board, last year, we implemented this electronic feedback versus, your in-person handwritten comments and surveys, which we had a very poor response for. You can see we're getting a better result, and we just want to share that with you so you can see that.
That's good, thank you.
So Liz, this is now electronic? It's both. Okay. So there still is that paper comment card you can use if you don't have the electronic, but this does get sent out if you opt in to receive the message, and it's a survey, like how many stars. It's very quick questions.
Kind of like a Google review?
Sorry.
I'm not talking.
I believe that's all the correspondence. I think this is Dr. Nevin's memo. Was that included?
Yes.
Okay. I don't know if, Dr. Nevin, do you want to speak about that under your report? It was included in the packet. You sent it over, and I think I directed Tammy to include it for discussion.
Right, thank you. If there's time under new business, I'll discuss that.
Okay, unfinished business, community clinical services.
Madam Chair, this time we can make a motion.
You can.
I'd like to make a motion that we postpone any movement on the memorandum with Dr. Nevin for 90 days in regards to closure of any teen clinics and stoppage of any community service that extends to the rural area where the teen clinics are.
Kevin, could you please repeat that so I can understand what you were asking thoroughly?
I'd like to make a motion that we postpone any action on Dr. Nevin's memorandum for 90 days that affects the teen clinics, closure of the teen clinics or any other, the closure of the health department services for 90 days.
Is there support for that? It's been moved and seconded. We can discuss it at this point. Just to be clear, Dr. Nevin's memorandum will take effect September 1st, regardless of what this board says, just for clarity. He is the medical director. He writes the orders. This is his order. What's up for discussion, in my mind, is does the board support that? And it's not about supporting Dr. Nevin. It's about the clinics and the clinical services, is how I see this. And so your motion's fine, but this will take effect September 1st.
I'd like to amend the motion, Madam Chair, that this board, that we show, do not support, that the board does not support the memorandum going forward September 1st.
Amend to, so you're amending the motion to say that the board does not support the memorandum.
Yes, that this advisory board does not support the memorandum of Dr. Nevin to close the clinics and other things that's there as, you know, on September 1st.
As stated in the memo.
Yes. And I believe Marie has supported that.
Okay. Is there further discussion on that?
Yes.
Okay.
Okay, so there seems to be a narrative here. Obviously, there was a campaign, many people said that they didn't know about the, meeting until there was email, so I'm sure there was email chains that were going around. There will not be any discontinuation of vaccine services. The health department will continue to provide vaccine services for all citizens of the county. For those of you who wondered what my background is, I'm a physician assistant of 24 years who serves our veterans who are waiting for me in Yale to serve them. I had to reschedule many patients and able to be here. The commitment that I made, yes, I am here. This is my commitment. However, the meetings haven't lasted 4 and 5 hours like they have been recently. So I do want to take care of my veterans. I also am from the Yale area. I listened to every one of the expressed concerns and read nearly every email that I had time to read on my own time. I sensed also the hostility of many of the staff towards Dr. Nevin. I now understand the necessity to halt these community services, temporarily halt them, in order to rein things in and reassess the situation. In direct response to Mr. Watkins, when he said we are hurting the kids if we close the clinics, many of us fought for those kids 5 years ago when they were forced to wear masks over their nose and mouth as they sat for hours in the classroom and ran up and down a basketball court or ran a cross-country race outside with a mask on, or when they were isolated during a quarantine. Their grades were failing and their mental health was in jeopardy. I fought for those people in that area also that were threatened of losing their jobs unless they were injected in themselves with an experiment, what they felt was an experimental vaccine. Where was the outcry from Thursday's crowd at that time? As I stated before, the current structure of the health department staff is broken. I see it in the division last week. Dr. Nevin's education, clinical training, 5-year residency in public health, board certifications and awards are impeccable. His area of expertise, as well as his background, is a rarity within a community, within a county health department, and we are lucky that he is here in St. Clair County. The teen clinics have not been present for decades, as some are saying. The Yale Clinic has only been there for a few years. I don't know about the Algonac Clinic. I know Port Huron Clinic has been there longer. What I have also discovered over these past 5 days, there is a nonprofit organization called Community First Health Centers that offers primary care, women's health, behavioral health, dental, and more. There's homeless services and there's WIC services.
I'm sorry to interrupt you, but we're at 11:01. And by last motion, we were going to end at 11 o'clock at a fixed time.
A motion that we,
So I have to, honestly, I have to think about this for a second because we have a motion on the floor. And so I think that has to be dealt with. And so I will, if everyone's agreeable to, yeah.
Madam Chair, that's your prerogative certainly, but the original motion to end at 11, that took precedence to all
Correct.
these motions. You can table these, close them out, but as I see, without further
Right.
action, the meeting's over at 11. And I could stay, I have a sandwich, but out of respect.
Madam Chair, I would like to withdraw my motion.
Okay. Do you agree to the withdrawal? Okay, withdrawal.
So we must end the meeting now.
Yep. We are adjourned.